Good afternoon and welcome. I'm Jim Pursley, president here at Hinge Health, and I'm thrilled to be kicking off this new episode of Pain Points with a few exciting changes you'll probably notice, like a new Hinge Health logo and brand. Our new logo is an abstract H made of four perfectly imperfect loops, and it represents movement and the individual path each of us takes to better health. Our logo and colors have changed, but our commitment to putting our members first remains as strong as ever. Today, we have an exciting new episode of Pain Points, an ongoing series where I'm joined by leaders and experts and practitioners from industry and academia to explore topics at the intersection of healthcare, technology, and innovation. In this episode, I'm joined by Courtney Stubblefield, Insights and Solutions Leader of Health and Benefits at WTW, to discuss the importance of evaluating benefits through the lens of ROI and the role that third-party validation plays in these approaches. Courtney, thank you for joining us today and welcome. Thanks for joining us from Houston.
Hi, Jim. Thanks for having me.
It's great to have you here. And just before the holidays, we were actually welcomed by one of your colleagues, Regina Erke, where she joined us on Pain Points, and we discussed the state of the industry and her predictions for 2023. I know you've also been at WTW for quite some time, and you've seen a lot. You've developed a lot of valuable experience and have an informed point of view. So I'd love to maybe just start by letting the audience get to know you a little better. Can you share some of your background and what the Insights and Solutions team you lead at WTW is up to these days?
Yeah, absolutely. I get to lead our Insights and Solutions team, which is actually a really cool job because it's essentially 11 different teams of all of our specialists and experts in the business. So our pharmacists, our clinicians, our mental health experts, voluntary benefit experts, actuaries, analytic types, absence, disability, life experts, global benefits. I mean, it's a lot, right?
Yeah.
But it's the lifeblood of what we do, right? In terms of advising and supporting all the employers that we work with.
Yeah, you're really sitting at the heart and soul of healthcare transformation and what's going on in the country now. As I think about some of the things that you rattled off, you look at the news and you look at what's happening with the price of insulin and the role that drug companies and PBMs are playing. Talk about mental and behavioral health. You talk about all the clinical challenges that we're facing and the opportunities that we have in front of us, including in places like musculoskeletal. It must be an exciting time to be leading that team. And if I understand correctly, your team's also responsible in evaluating return on investment and the ROI and the economic impact, as well as the clinical impact of a lot of those solutions that you outlined. Is that true?
Absolutely, yes. So we have kind of data experts, actuaries, and clinicians involved heavily in data, and it really takes all of those together, I think, to really effectively evaluate. And ROI studies, as we know, and we'll talk about more, I'm sure, here in a few minutes, are more important than ever to our employers that we work with.
Yeah, maybe, Courtney, you can just start with how you think about WTW's role in that. ROI is something that I think benefits leaders and clients are continuously interested in, and maybe even more so as we potentially face a recessionary environment where cost control is going to be front and center. But how does WTW think about your role in that as it relates to also companies in the space, companies like Hinge Health and others focused on whether it's cardiometabolic, behavioral health, pharmacy? There's a lot of us working hard to deliver an ROI. How do you think about WTW's role in helping to assess that?
Yeah, absolutely. I mean, it's been an evolving role. And, it's kind of interesting to sit back and think that we are roughly about 10 years into what we can call a revolution of new solutions and health innovation, right? In the vendor space, point solutions, whatever you tend to call them. I think they're becoming a foundational integrated part of employer-sponsored health programs. So, I think they're accomplishing a lot of things, but one of the things that is rising and has risen over the last few years, I think even more so, is what's the cost impact? What is the effect financially? But those solutions obviously bring a whole lot more than just the financial component, and the impact on well-being, the impact on improving quality of people's lives. Employers want to embrace innovation. So there's a lot of other reasons as well. But like you just said, I think two big things, right? We had the pandemic, which I think put a spotlight on the need for digital, mobile technology intersecting with healthcare. Virtual care obviously had an explosion during that time. And then the cost environment that we're in. So we, based on our data, 7 out of 10 employers are significantly concerned about moderate to significant cost increases in healthcare. And we think that time frame of worry is really 23 through 25. So, and, the majority of employers are telling us they expect to be over budget. So that's putting a lot more scrutiny on the cost, but it's also a time in the evolutionary curve for these solutions to understand the impact on cost and financials. So all of that has led us to do more.
Well, fantastic. Well, we appreciate your partnership. And as you think about, we'll talk about maybe some of the things that are harder to measure. You mentioned some of them from employee health, well-being, maybe satisfaction, productivity, absenteeism, some things that are hard to measure. And then there's hard dollar savings. I think, most of us who walk through the doors of an employer to present our solutions or offering are coming with, at least on PowerPoint, a compelling ROI. How credible, how believable are these ROIs that you're seeing? You've got a pretty broad purview. How credible are they? And again, what's that role that WTW plays in helping the employer assess that credibility?
Yeah, I would say, like most things in life, I think there's a continuum there of studies that, I think have been conducted the right way, or, using data and methodology that we would consider sound. I think there are other studies and other claims being made that, we poke more holes in. So our job is to be as objective as possible, right? And bring a critical eye to those. But, there's an increasing body of work in this space. And so our role is increasingly one to evaluate those studies, conduct some of those studies, review more of those studies. And certainly we do many of them for our largest clients, uniquely for those employers. So we have a whole host of roles there, but it's definitely evolving. And harder things to measure, as you mentioned, meaningful engagement, the effectiveness of the integration, the impact on people's lives, impact on employer retention, productivity. Some of those things are harder to get at. So I think we take it in a staged approach, right? Looking at the direct impact on cost, claims, utilization, and then, there's an intent to evolve from there.
Some of those hard to measure variables, do you try to include those in the ROI analysis? Do employers and benefits leaders want them included? Do you encourage them to think about that? Or do you try to kind of carve it out and really kind of think about, hard dollar savings first and foremost?
I think the latter. I think the starting point is the more hard dollar impact. And we want to get measurement, tools and methodologies around that. There are some studies, but they tend to be more, I think unique standalone studies to try to get at productivity and to try to get at some of those softer measures. We may see these things come together in the future as we get more normalization and more standard ways of doing this. That's ultimately, I think, what employers want is a more standard benchmark and set of measures of value that they can trust. And there isn't so much variability.
Yeah. It's hard to quantify some of that. I remember sitting with the head of benefits of a large U.S. airline a number of years ago, and she was relaying to me, her CEO sat her down and said, "Listen, we have pilots and flight attendants. We have a mental health crisis on our hands here. We're dealing with suicide, and I don't care what it costs. Figure this out." And that was her mandate. And in that situation, she probably was less focused on ROI. There's other times where maybe you get called into the CFO's office and get told we've got to bend trend by, we got to cut trend in half or whatever it is, and hard dollar savings become paramount. And hopefully, if we do our job well, they're not mutually exclusive, and we can impact both. And we just, as you probably know, we just launched our women's pelvic health offering, and some of the conditions in women's pelvic health maybe don't show up in claims. But you better believe, as I've traveled the country talking to our members and to our clients, it shows up in a lot of other metrics around employee satisfaction and engagement and overall well-being. So we've got to balance it, I guess, as an industry. And but I think if we do it right, they're not mutually exclusive.
Mm-hmm. Agreed.
Yeah. So as you help consult and advise your clients, whether it's the hard dollar savings or the well-being and happiness elements, what are some things that you encourage your clients to keep an eye on? And maybe before you answer, I'll just also invite the audience who's joined us today to, if there's any questions, feel free to submit those in the chat. We'll do our very best to answer as many of them as we can. But turn it back over to you, Courtney. How do you encourage your clients to think about that? Things to think about and things to look out for.
Yeah, and in regard to kind of ROI analyses and kind of financial looking efforts. So I think the first thing is to understand the background of the study, the methodology. I think how is it put together. So I mean that requires some level of expertise, right? So that's one of the things that we're well equipped to advise our clients on. I think who conducted the study becomes an important question. And not to say that there's anything inherently wrong with self-directed studies, that those happen, but I think there is a value to that independent review and validation. And I think increasingly, as we look to more consistency in the measures and normalizing the process, so we can compare things on a more apples to apples basis, I think that will become even perhaps more important, and it'll be easier. It'll be more straightforward. I think, what is the study measuring, to your point earlier, right? Are we looking at claims cost? Are we looking at utilization? Are we trying to look at other elements? What's included, right? And how are the case controls, matched for that, if that's the kind of study that's being done, which is fairly common. And then, studies that have extreme, what we'll call very high claims of ROI and savings may draw a lot of attention, but they're also going to draw more scrutiny. So that isn't to say that those can't be validated, but I think it is important to understand what the message of the study is. I think that does the study contemplate, one of the newer things we're seeing is some ROI studies will talk about the conditions under which they think those ROI savings are achievable. That's kind of a next level of providing some richer information, right, to the employer or whatever group is kind of trying to assimilate the findings. What are the things necessary to achieve that ROI? And then do the ROIs correlate in the study to perhaps what the vendor or the solution is willing to put at risk in terms of performance guarantees? Is there a connection there? So those are some of the things I would throw out are first level good things to look at and questions to ask.
Yeah, that's helpful. Do you find, is there ever a tension between magnitude and credibility? And what I mean by that is, in a previous life, before Hinge, there was a company I came across that had a 12x ROI in their marketing collateral for a while, and they ultimately pulled that back. But one could argue, regardless of what the solution is and what the condition is, a 12x ROI maybe calls into question some credibility. That again, that's a little bit of an extreme example. But do you find there's a tension at times between kind of magnitude and credibility?
Yeah, I mean, I think that's natural, right? There is, and there are some claims that have been made that I think call into question the reasonableness of the result. So, I mean, it's just important that, we can there's a lot of disclosure, as much transparency as possible on the methodology and the data sets used. And because, people like us, WTW and others, are going to unpack those and ask the questions. So, but I think, there is a tension there. And I think it also, significantly raises the expectation of what, the impact's going to be for an employer group that might decide to buy or invest in that solution. Time frame is also really important. And I feel like that's oftentimes can get overlooked. Is this, is the ROI that's been evaluated at a year? Is this at 2 years, at 5 years? Again, nothing goes wrong more quickly, right, than when expectations are set really inaccurately. So, those are,
I think hopefully some of those other elements, study design, sample size, time horizon, hopefully those become kind of increasingly visible across the industry. I do think it's important when you think about, drug trials, and if you didn't know if it was on adults or children, men or women, what's the sample size, we wouldn't have confidence in the results. And yet in digital health, sometimes, I guess we look very quickly at the number, but don't maybe look at the details. I think it's to all of our benefit that we start to dig into those details, with greater and greater focus. So, speaking of that, we recently engaged WTW to help provide some of that independent validation. We have been seeing some really positive results, but there's limits to the credibility of self-generated results, as you mentioned, and so we engaged WTW to take a hard look and to do an analysis. Specifically, we did it at the industry level, thinking about does a manufacturing client look like a professional services firm, look like a transportation company, and so we really dug in to two specific industries, manufacturing and services, and asked WTW to look at the methodology and whether we were holding ourselves to a high enough standard. And I think it was really educational for us and challenged us and pushed us to get better. What's interesting is, we showed a 2.7 ROI, or a reduction of over $2,600 per member in the services, and a 2.0 ROI in manufacturing, which with a reduction of about $2,000 per member. And what was interesting is I would have probably thought that manufacturing would have been higher. I guess maybe that's just bringing my own preconceived notions around populations, but I would have maybe thought we would have delivered a higher ROI in manufacturing than in services. But again, really putting that through a lot of scrutiny and rigorous analysis by WTW. So a lot of that, over half of that came from reduction in surgeries, and then the other half came from utilization of other things like imaging and PCP utilization, et cetera. But Courtney, I think you and your team. I know you and your team were involved in these analyses. Maybe just give us a little different perspective on maybe some of the differences you may have seen, or some of the opportunities that we have ahead as we think about doing more and more of this analysis.
Yeah. So WTW did have the opportunity retrospectively to review the methodology, right? And let me just say first out of the gate, I think that the selection or determination to kind of talk about this from the services and manufacturing industry perspective makes a ton of sense. And, those along with a couple others like transportation, have some of the highest incidence of musculoskeletal disorders. And our clients in those industries see that in their claim data, right? They have the highest, these MSD, MSK usually ranks at or near the top of the list, maybe just right under cancer, perhaps. So, very, very relevant from an industry perspective. And, I think that is intriguing. That was intriguing to us. We work together on a lot of clients. Hinge is very focused on data and analytics and has been that way for a long time, since inception. So we did come in and we were able to review the methodology of the studies that you all conducted. And, we looked at the things like the selection process for the case controls. It was a match case study. We looked at the matching criteria and the propensity scoring and some of the details behind that, the way that you did the statistical analysis. We did not review the data, so all the cases. We did review some of the output, though, and we were able to also obviously see the conclusions. And so I think this methodology was reliable, right? And it uses kind of accepted practices from our perspective, and I think from an industry perspective at large. And so I think that this will be very informative, especially to employers in those industries. And, as we go forward, I do think the industry look is more important than ever. It feels like we have critical mass of data and longitudinal experience now to continue to make that even more robust, right?
I was going to ask you, because
yeah.
Oh, I'm sorry. Go ahead. Sorry.
Yeah. Well, I was going to say larger data sets, longer periods of time, longer look backs, more look forward, making sure that we can, get all of the direct claim data, pharmacy data, things that can continue to be added into that. So, but yeah, we were happy to do that. And, the methodology we found to be sound.
Yeah. I was going to ask you, from our perspective, doing industry-specific studies, it does add cost and it does add time because each one of these analyses takes time. And so, do you think it's I don't know how to say it, the preferred way, or it's worth doing it that way versus aggregating multiple client segments, industries? Does the client perceive the value in, hey, this is a study for a population that looks like my population in my industry? Would you encourage folks like Hinge and others to focus on industry specific if you have a large enough data set?
If there's a large enough data set, I mean, one of the biggest challenges for any employer group is being able, and there's often an innate desire, I'd like to evaluate the ROI from my group, from my population.
Right.
And the unfortunate challenge is that's a very hard thing to do, to get enough encounters and enough incidents to have, the reliability and the credibility of the underlying data set. So, we end up in a place of aggregating. So, and we're going to be aggregating forever, probably in many different spaces. It's a standard approach. I think, there's room for all of that, but as things have matured, and I think it will depend on the clinical area, it'll depend on the service and the solution domain to some extent. But as we've matured, there's more data, there's more time, there's industry cuts I think are more important than ever. And especially in a space like MSK, where that there are significant differences, from an industry perspective.
Sure.
So it's going to be circumstantial, right? Based on, but I think the mental health space is something where I also am eager to see if we can move down a path of having enough data with some of the newer solutions to look at industry. But, the broad-based aggregated data sets are also very critical, especially at the point in the juncture we're at right now. So,
yeah. It does take a little bit of time to build that data set. It took us a little while to get to, over 1,200 clients and hundreds of thousands of members. And, I think we're at the point now where we can have sufficiently large data sets in fairly specific industries. But it takes a little time. And I think as some of these other industries evolve and mature, they'll get there as well. So we do have a question from the audience. We have a couple of questions. One I'll tackle here is, what's the right time to share your historical claims data with a potential vendor to do a benefit analysis? And what tactics have you seen to get partners comfortable with sharing that data? And I don't know exactly what they mean by partner, if that means the health plan and getting the health plan to be comfortable with sharing the claims data, or if the question is Hinge comfortable enough to share our data with a WTW or a client? But how do you kind of think about, I guess, maybe, what's the right time in the process, in the evaluation process, to kind of interject, this type of analysis?
Yeah, I think you need to be 2 to 3 years in. I think that these types of analyses may correspond, and increasingly so, to when a group may be looking toward renewal. So now that not that they can't be done with a year of data, but I think 2-3 years starts to give you, a base of data that you can work with. And increasingly, I think part of that renewal process is going to be understanding the cost impact. I don't know that renewals are going to be maybe as automatic as they've been in this space. So that, and obviously once you go beyond that, you start to keep building and you have more to work with. The second part of that question is a critical one. How do you necessarily get all the data that you need from your other parties on the medical and pharmacy and perhaps other sides to share what you need? And that takes a bit of science, of art and science to get done. So we work routinely with our employer-based clients to do that. When we have a data warehouse, that can help. But oftentimes, there's an individual kind of single negotiation around getting some of this data, but we are getting it. And there is a way to structure that so that we're not taking something they consider too proprietary. There's absolutely ways to get this data and make it work. But don't underestimate the time, right? And don't underestimate the effort that it will take for you directly or people on your behalf working to get it.
And I guess talking to any employers or benefits leaders on the phone, it is their data, correct? Whether it's coming from
our position, 100%,
pharmacy or medical or anywhere else, it's their data, and sometimes it's not as easy to get access to it as it should be. But But is that your position? And that's the one that we all
100%.
maintain?
Yeah. We go in with that mindset, and we lobby and work on behalf of our employers that way. There is a tension there, right? With some of the carriers and others in the industry to necessarily get all the data that we want.
Yeah.
But it's, we actively are working on that on many, many fronts, not just ROI studies, but, other ways to assess networks and all kinds of other things.
Well, good. Well, I think, light and transparency is a great disinfectant. And I think, having transparency in the data, advocating on behalf of your clients to get the data, and pushing, folks like us to be transparent with the data, even when, the outcome is potentially uncertain or a little bit scary. That's how we all get better, I think, as an industry and move it forward. And so I think WTW can play an important role in pushing us forward and promoting that transparency. Courtney, as we come to the end of our time, I if you don't mind, I might put you in the spot a little bit. You have a really broad purview. You see a lot. You get to have a lot of probably very interesting conversations. So as you sit here in March of 2023, as we look ahead at the rest of the year, I guess we'll end with any predictions or any things that, as you look forward here through the end of the year, that have you especially excited, concerned, interested as we get ready to wrap up the first quarter and head into the rest of the year?
Well, we're very laser focused on cost, because that's what's really important right now to our clients. I just wanted to reemphasize the increasing role I think that ROI impact, first and foremost, on direct cost plays. We conducted a survey at the end of 2022 on vendor strategy, and we heard pretty loud and clear that our ROI is among the top 3 criteria in evaluating effectiveness of vendor strategies. We think that's only going to increase. But our strong point of view around that is to make sure, in addition to thinking about ROI just very directly and specifically on those kinds of costs, it's important to assess what each group is looking to get from the vendors that they choose. And that starts to bring in areas of a lot of focus for us around improving quality of healthcare, and also dealing with all of the health equity issues that exist. So a vendor that can make significant impact in engaging a particular population, that might outweigh the ROI in the short term. Eventually, obviously, we want to understand the cost, but it's real important to assess, what am I looking for out of this relationship, both on the qualitative and the quantitative side. One of those isn't going to fall by the wayside. They're both critically important. But I do think in this period we're in right now, there is intense focus. Most renewals I would expect to be up for financial scrutiny. We're glad to see these kinds of studies coming out, and we want to help employers get, an analysis of their own data to the extent possible.
Fantastic. Well, one of our next projects, maybe I would love to commission WTW to help us come up with a better term than vendor. There's just something about that I just struggle every time I hear it. Everyone uses it, but all kidding aside, though, thank you, Courtney. I think a couple of things just to maybe summarize is, we heard about this year. ROI has always been important, but this year maybe more than ever, ROI is going to be front and center. There is both a hard quantitative way to assess ROI, but there's also qualitative elements, and they're not mutually exclusive. They're both very important. And to the extent that a partner or vendor can deliver solutions on both those fronts, it's going to be to their benefit and to the benefit of the client. I just really appreciate, I know you have a lot on your plate. Insights and Solutions is a broad and diversified group. You have a lot of things going on. I really appreciate you taking the time, Courtney. Thank you. For our audience, Courtney Stubblefield, Insights and Solutions Leader of Health and Benefits at WTW. And to our audience, thank you for joining us, either live or later. I've really enjoyed this episode of Pain Points. As we look forward to tuning into our next episode, we're going to discuss the state of MSK, where we're going to do a deep dive into the state of MSK across the board, not from a Hinge specific point of view. And we'll be doing that on March 23rd. You can follow Hinge Health on LinkedIn or at Twitter for updates. And until then, I'm your host, Jim Pursley, and we'll see you again next time on Pain Points.